I'm here to share with you the results of the RADIUS trial. This is a randomized trial, an open-label randomized trial of using a tyrosine kinase inhibitor, midostaurin, in patients after transplantation with a particular mutation, which is the FLT3 ITD, or the internal tandem repeat mutation of this particular gene. Now, why is that gene of note? It's one of the most common genes in adult leukemia. 30% of patients will have this mutation, and historically it's been considered a marker of poor risk disease that we would predict to have a short survival without transplantation, and one of the markers of a patient that should proceed on to a donor transplant, and a high priority to proceed to a donor transplant early in the course of the disease. Now, there's a drug called midostaurin, which actually has been approved, and both in Europe and the United States, for as an adjuvant treatment or as a part of the induction treatment and consolidation treatment of new diagnosis patients with acute leukemia, and it's been shown to improve survival. Very little has been known about using it in the post-transplant setting. I think in the last few years, there's been an increasing focus on adjuvant therapy and what you can add to a standard transplant to increase the likelihood of disease remaining in remission long enough to establish the donor immune system to give you a immune-based anti-leukemia effect. What happens is, while we wait to establish that immune system, from the donor, disease can relapse. This is a drug that can actually block the relapse. This was a randomized trial, 30 patients per arm, and that 30 went on to standard of care, 30 received the drug. And at the end of the day, half the patients were able to stay on the study through to its completion, which was 12 months of adjuvant midostaurin. The remarkable results at the end were that the drug was relatively well tolerated, but we've also seen that 85% of patients 2 years beyond the transplant time remain free of disease with a low relapse risk. Interestingly, the standard of care also had a superior outcome to patients than what we would have anticipated, and that may be in part due to partly the trial design, but also the fact that some of the patients went off study, and anecdotally, they were seeking other agents that could have the same biologic effect. Either way, what we think is the exciting data is the fact that a disease that was often associated with high rates of mortality is now showing that we can cure many of those patients, and in a way that this is similar to other new emerging studies, that we may be changing the whole natural history of this disease.